Okay, just a few more, I'll say one more minute and we will go ahead and start. Thank you so much for your patience. And thank you to all of you joining us for your time today. To everyone on LinkedIn, be well, we're glad to read your comments whenever you are posting those. It may take us a few minutes to respond to you, but please share. We want this to be very interactive. And this is a very interesting subject. So I know that I will have some interpreters, some project managers, um, some folks from the language access world commenting. So it'll be great to read your comments and maybe answer some of your questions if we have the time. All right, just to be respectful of everyone's time, let's go ahead and start our conversation today. The title of our roundtable is Innovations in Language Access for Modern Healthcare Network. My name is Katherine Adames, representing Effectiff and also leading this conversation today. We're hoping that it is interesting for everyone listening in. With me today, three language access experts, and I'll go ahead and allow them to introduce themselves, starting with Moojan.
Hi, good morning or good afternoon, everybody, depending on where you are. My name is Moojan Razvan. I oversee the Interpreter Services Department at Providence Mission Hospital, and I am very happy to be here today with you all.
Thank you so much, Moojan. Carlos?
Hi, everybody. Hello, I'm Carlos Garcia. I'm a project manager specializing in language access projects with many organizations, and I also do other kinds of projects regarding diversity, equity, and inclusion. Until a few months ago, I was the language bank coordinator of LPCH, that's the Lucile Packard Children's Hospital, Stanford. In the language bank, what it did is it just reached out to the community to get languages of not non-Spanish languages like Arabic. If somebody needed Arabic or Mandarin, then they will page me. So that's what I
Great.
did until a few months.
Thank you so much, Carlos. Stefan?
Yeah, hello everyone. Great to be here. My name is Stefan Korotayev. I'm CTO of Cloud Interpreter. It's a remote interpretation platform, and I'm 20 plus years industry veteran. Right, started out as a translator editor, and later shifted to technology optimization, and gradually made my way to my current position.
Great. Thank you guys for being here. I am pretty excited to hear your takes on the subjects that we'll be touching on today. And I think that this world is moving very fast. And with the world moving fast, especially in technology, we also see the healthcare industry kind of adopting some new technologies. Maybe they are moving a little bit slower than other industries like ours, language access, but it'll be great to hear your responses to some of the questions that we have today. Once again, those of you who are live with us right now on LinkedIn, please feel free to share your questions, share your comments. This is a pretty interesting subject that we're going to be touching on, and we would like to read from you and hear from you later on. If in the event that we do not have time to answer all of your questions, someone from our team will make sure to type in the answers for you. So thank you so much for your time. All right, so let's go straight into subject. And the first question that I have for you guys today is pretty interesting. What's one thing about language access in healthcare that most people don't realize, but they really should? Moojan, you want to go first?
Yeah, I can go ahead and get started with
Great.
that. Most people don't realize how much language barriers impact patient outcomes. Miscommunication can lead to misdiagnosis, incorrect treatment plan, higher number of safety events, and honestly, lower patient satisfaction. So, providing language access isn't just helpful, I think it's critical to delivering safe and quality care. It's not just a courtesy, safety. It's a legal and ethical obligation for every hospital out there. And patients have the right to receive information in a language they truly understand. And without it, their safety, their dignity, and the quality of the care that they're receiving is truly compromised.
That's wonderful. You touched on the law, and I think it's interesting that you say this because most folks that we talk to, sometimes on the healthcare industry, do not understand that we are just needing to have them comply with the law. So thank you so much, Moojan. Carlos or Stefan?
I would say that an interpreter does not a translator making, and for that I think I'm quoting Gregory Rabasa, who wrote If This Be Treason, and so I'm equating that translator, even though they're not the same, interpreter and translator, because just being bilingual doesn't mean that you are either an interpreter or a translator. There's a special skill set that is needed for everything that you do in those fields. It would just be like comparing bilinguals to car drivers. Any bilingual can speak two languages, and car driver can drive a car. But in order to be a race car driver, you need to be a trained professional car driver, and so
Yeah.
that requires extra training, and that's what most people don't understand.
I love that. I love that comparison. Have not heard it before, but I love it. So this is something that I will probably steal from you and use it in some conversations that I'll
Yeah.
have in the future.
I always tell my people exactly what Carlos mentioned. Just because you're bilingual, it's only 50% of being an interpreter. I'm not
Yeah.
a nurse for the same reason you wouldn't want me to start an IV on you. You shouldn't want someone who's not trained to be an interpreter be your interpreter. Exactly what like Carlos mentioned.
Absolutely.
And,
Stefan?
and there are a lot of things like culture, psychology, why we say the things that we say, and it's not that we're psychologists or language or cultural professionals, professors at a college level, but we understand those nuances and how they can impact language, and so
Yeah,
we look at that, we take all that into consideration when we render into the other language.
Yeah.
yes. Stefan, anything you
Yeah.
would like?
Yeah. Well, I think it's been already mentioned, right? That first of all, it's language access. It's again, so it depends on how you define this most people, right, in the question. So I think that if we think about people in healthcare itself, right, so it's one thing. But if we talk about the audience, the target audience of all these, the population in general, I think the one, I'm not sure about the most of them, but at least in the more vulnerable groups, it's your right. It's not a privilege. It's your right. You have the right to have access to all those services. So language access, it's in the law, and you're entitled to it. So I think that, again, not sure about most people, but very many people not aware of that, and they think that it's just they've been provided this because this particular institution is so very good, so very kind. But in fact, and it could easily be the case, right? Because it obviously varies from one institution to the other. It depends on the people working there, but it's your right, and you're entitled to these services. So it's super important, I think, for everybody to know that.
Absolutely. So I am quoting something I read as I was also looking into these questions. And it says, ensuring professional interpretation services is not just about compliance. It is essential for patient safety, equitable care, and better health outcomes. And to, just piggybacking off what Stefan says, it is your right. It is the law. And all of us in the language access industry have to kind of explain this all the time to not only to the workers on the healthcare, but also to the limited English proficient people that we come across, so that they can understand that it's definitely their right to make sure that the information provided to them in a healthcare scenario is in their own language. Thank you so much. Go ahead,
One last
Stefan.
thing that I want to
Sorry, Carlos.
mention about this is that we take a look at all those things, compassionate care, adversity first in healthcare, but the one thing that actually should make everybody just start doing this at the state level, federal level, is that it's been proven scientifically through studies that there are LEPs, which are limited English proficient patients, they experience longer hospital stays, higher readmission rates, more frequent frequent emergency department visits. So, and that all costs money. That all costs money, and it's money that you don't have to spend if you provide language access.
Totally right.
Yeah.
All right, so let's move on to our next question. Very interesting. So I want to hear your responses. In your experience, what's more challenging, finding the right technology for language access or training people to use it, and why?
In my opinion, training people to use it is more often challenging than finding the right tools. The technology exists out there, but ensuring that every staff member understands its importance, knows how to use it correctly, and most importantly, giving it priority even when it's really busy at the hospital or they're working in the ED and we have a lot of patients waiting. That requires constant training and reminders, and maybe even a cultural shift, really depending on the organization that you're in and what the culture is in that organization.
Beautiful. Beautifully said. Stefan, anything you would like to add?
Well, I think that first of all, you need to distinguish between doing something at scale, right, and just how difficult this thing is for one person. So I think technology should not be such that it's hard to train one person to use it, right? So otherwise, something wrong with this technology. So this is from my standpoint. But of course, when you're doing things on at scale and you have to make sure that it's uniform and across a large organization, then many challenges occur, and our other panelists are better positioned to tell us about it. But I'm just thinking that yes, the technology should be very accessible. It shouldn't be something. It shouldn't be a job requirement, right? So that you can be trained to use it. So at least outside of the some basic level of computer literacy that is expected nowadays from I think everyone. But other than that, it should be very easy to use. It should be very intuitive, and it should be like easy to roll out to in the organization. But again, as I said, yes, this challenge of making this understood and usable by very many people in a large organization is always a challenge, of course.
I
Yes.
think the challenge is mainly hardwiring the process. It's not really how to use the technology because we all use cell phones and iPads and tablets nowadays. It's hardwiring the process when a patient is there, an LEP patient is there, and you have a million other things to think about. Getting an interpreter to be able to communicate with that patient should be on top of your list. It's that part of the training, not the training on how to use the technology.
Correct. Carlos?
I think that both aspects present unique challenges, but training people to use technology effectively can be way more difficult. While finding technology involves a lot of research and investment, ensuring that your staff, your healthcare staff, knows how to use that technology is difficult. It needs to be, there needs to be ongoing, constant training. Let me just give you an example. A lot of people nowadays they don't know how to use the pager system.
Right.
And it's fairly simple. I mean, it's 1990s technology, but we still use it in hospitals around. But new people that are coming to work for hospitals are not being trained on how to use pagers. They just think it's a given that they know how to do that, and they don't. So I think it's a little bit about that. As a language plan coordinator, I found myself in the situation where I had to quarterback sessions. And by that, I mean that we already had the platforms in place, the technology in place to service video interpreting, especially when the pandemic hit. But I found myself quarterbacking this because I actually had to do a manual connection between the provider and the interpreter because nobody knew what to do.
Right. Yeah.
I think us in the language access world, and I'm talking about maybe LSPs, language service providers, we have a big responsibility when it comes to technology. And just adding on to a bit of what Stefan said, we definitely, and thinking about technology as a whole, the technological part of it, not the, like Moojan was saying, and I agree totally, not the process part. We have a big responsibility because we have to make sure that our services, the services that we provide, are easy to access. Therefore, we have to make sure that the process that the healthcare organization follows are easy. We need to make sure that if it's on demand, virtual, click here, click there, and just follow the prompts to be connected to an interpreter. And I think we've done a great job, at least internally. I know we've done a great job with this, but also we need to be part of training the staff. And something that I find useful, that we have done for many years, is that we offer, when we are onboarding a client, we offer to demo and show them how simple it works. And I think that that right there breaks a bit of ice, and it helps the client out. And we want to hear the feedback. We want Stefan and his team to hear the client say, okay, maybe if you guys, make a change here or make a change there, or if we could add it to this system or whatnot, it will make it easier for us. But then also making sure, like Moojan said, that everyone understands. And I read someone in the comments say, Misty, she said, it's a priority. Language access is a priority. How am I going to communicate with you if I don't understand you? So at the moment, we wire our staff to understand that the first thing you do when someone walks in and they probably would say, no English, try to find the language that they speak, and use your resources, your technical resources, to get them the assistance that they need. And I know I shouldn't be answering these questions, but I find it a great opportunity to share some of our experiences, or my personal experience, and I think it's, people tend to be scared to use the technology when it comes to language access, but the outcome is typically the same for many languages, and I would say for top languages in the US. So if we, as professionals who have been in this industry for many years, are also able to express and show how easy it is, we are definitely going to make patient outcomes be more positive.
You
All
nailed it.
right. All right.
Good job. Yeah.
I was just copying you guys, okay?
Yeah.
No credit for me. So
Yeah,
how,
and if I
go
can
ahead.
add a couple of cents here, yeah. So and from a purely technological standpoint, I think that integrations are also very important, right? Because
Yes.
when it's not a separate process, standalone process, which is very often the case, right? So when you need to do your main job and then also be aware of this separate process that somehow should be prioritized in some cases, and you need to quickly switch to that process instead of being able to stay within your EMR or whatever you're using, whatever information. It's not specific to healthcare, any industry. So if this, I don't know if you have this kind of, to simplify things, this kind of button like call an interpreter, right? And within your main informational system, that
Mhm.
always helps you to,
Integration,
yeah,
yes.
Yes.
to
Integration.
remember what to do, even if you, some of the details kind of faded away and you can't remember, but if you can just click this button and it's visible on your screen wherever you go in your system, it always helps.
And it does
Absolutely.
the automatic documentation for you, because one of the
Mhm.
things
Sure.
that we really focus on is, okay, now you used an interpreter, now we need you to document. That's another process that we have. If it can simplify all of that for our frontline staff, then that would be amazing, more efficiency.
Yes,
Yeah,
absolutely.
absolutely.
And then using the data that we save, it's, I think it helps with one of the steps of the language access plan, to make sure that everything is documented, and that we survey to see which languages you're using, which areas you're servicing, which parts of the hospitals are using more the services versus the ones that are not. And that is also part of the beauty of adding technology to our language services industry. All right, let me see. Yeah, no more comments on the live chat here. So I'm going to move on to our third question. Interesting one as well. How do you make sure that language access isn't just a nice to have? And I remember Moojan said something like this at the beginning, but a must have in healthcare systems.
I think we already established that it's a must-have. But again, to make language access a must-have, you need to make sure that everybody knows the why behind it. Why are we doing this? Why are we providing these services for our patients? And the why behind it, and it integrates into the core operations of your healthcare system, maybe through policies and procedures, maybe through constant trainings. We all have modules, annual modules or quarterly modules that we have to follow in healthcare industries, in hospitals, maybe through that, and through accountability. If you're not using it, what's going to happen? What is the
Mhm.
accountability here? Linking it to patient safety, studies show that LEP patients have more adverse events, adverse patient safety events happen to them than English speaking patients. So linking it to patient safety, quality metrics, and legal compliance.
Yes.
That should really help demonstrate that it's not just an extra service; it's essential
Mhm.
for providing equitable and quality care.
Yes. Carlos?
Well, I think that I agree with everybody here. Language access needs to be prioritized. It is a law. It is it is compassionate care. It saves money. It saves lives. It increases patient satisfaction. I just think that healthcare systems need to take note of this and make sure that they prioritize language access and they should integrate that into their core policies and procedures. And how many times have we seen that plans are made without taking language access into consideration, and then we find out at the last minute that, oh, we need an interpreter. Nobody knew about this. And there was an example about Ramadan last year, I think, and everybody we had tables set up and with this big festivity and everything, but nobody asked interpreter services and about
Mhm.
Arabic and what else does the hospital need to take into consideration in order to have a successful Ramadan feast. But I think it's because it's that lack of prioritization of language access that
Yes.
that led to that. So I think
Yes.
it's just incorporating those policies. Language access into core policies and procedures is a must.
Correct. I totally agree with both of you. Stefan, anything you would like to add?
Well, as a technology provider, I can only say that we try to help language access teams that we work with in their tough job to persuade their higher ups that their work is as important as it actually is, right? So sometimes it comes to some customizations, sometimes it comes to some numbers that they need that will help them either just performing their day-to-day work or showing the results of that work to people who oversee and supervise their units. So I think so our job is just to be there for them and to help them however we can.
Yes. I think that part of how we make this happen is having these roundtables and webinars, because many people that join do not know that it's the law. There is a law that has been for many years that states that we have to make sure that we are able to communicate with people in their language. And I think that maybe healthcare organizations should include this part on their onboarding booklets or into their onboarding process, so that their staff understands how important it is for someone to speak in their own language. And then us as language service providers, how can we assist them, also helping them communicate to their staff as we do the demos and as we do the onboardings, that it is the law. I heard from someone before when we were offering language services. I think it was a patient that said, or I can't remember who, but someone said the hospital would, I remember now, but I can't share. The hospital will only provide ASL services when they're sued. So why wait until you get all these lawyers and the law involved? Just make it easy. If you don't want to spend a lot of money, use on-demand services. On-site services are not just the only thing that we offer. So why wait until the consequences of not being compliant or understanding that it is the law come to backfire?
Hmm.
Let me
Yeah.
see.
And it's not, Kathleen, it's not just lawyers and money. The hospital has to be involved for a lengthy process. When a
Yes.
lawsuit happens, especially for American Sign Language and deaf patients, the risk department of the hospital or the quality department of the hospital is involved with a lengthy process of 2 to 3 years with Department of Justice, talking
Mhm.
about their action plans. This is what we're going to do so this doesn't happen again. So why can't we just be proactive and really prevent these from happening to save
Correct.
everybody some time and money?
Correct.
Yeah,
Mauricio
absolutely.
says spread awareness among healthcare professionals, have conversations with them about the importance of our services. Yes. And then Misty said, we have found that storytelling, patient safety, etc., puts the people behind the importance of the language services that takes away some of the nice to have thought process. Yes, patient's experience. It's important to share. Patient's experience is very important to share. Thank you so much for your comments. You can go ahead and add as many as you would like, and we will try to read. And if there are questions, we would also try to respond to those. So, anyone else wants to add to this last question, or we can move on? No? Okay. From all the questions that we're going to touch on today, I think this is one of my favorites. I shouldn't be picking favorites, but this one is definitely one of them. So, if we could change one policy related to language access in healthcare, what would it be and why? Carlos, go ahead. I think Moojan, are
I
you going? Go ahead,
I
Carlos.
I have one in. I don't know how popular this one's going to be, but take this into consideration, right? Language access has been an issue since 1950, since World War II, right? It was actually an issue before that, but anyways, that's when we came to learn about language access, the Nuremberg trials. But anyways, here in the U.S., it started in '84 with the evolution of guidelines and protocols and all that. Since then, we've had certification. And but still they're not, a lot of people are not certified, a lot of people are not trained. It's been since '84 until now 40 years of this. I think it's about time to take the next step and have a key policy change that will mandate the use of licensed interpreters and translators, not certified, because there needs to be government oversight, there needs to be government accountability. They need to watch, because this is a basic human right. It cannot be just left to nonprofit organizations developing exams. I mean, drivers need a driver's license in order to
Mhm.
drive.
Mhm.
Interpreters need to have a license. I mean, social workers have a license, nurses have a license. Why are interpreters not there yet? I don't think we're given the importance that we need, that we deserve, because of what we do. So I think the mandate licensed interpreters, it's the next step, is the way to go. I think that's one key policy change that
I think we lost Carlos there. Pretty interesting, but it makes me wonder how easy it would be, especially of how difficult it is now to get certified as an interpreter.
Hmm.
So yeah.
Yeah. I was gonna have a follow-up
Yeah,
question for Carlos, but we lost him because
right, right.
like I want to know what he means by license. Like, does he mean
Yes.
certified or qualified? Because there are two different
Yes.
ways
One.
of approaching this, and we don't want to do. So I'm in the state of California. I don't know how much you guys know about state-specific requirements. For
Mhm.
example, in the state of Oregon, they came up with
Right.
this requirement that everybody has to have at least 60 hours of training,
Yes.
and it's backfiring at them because
Yes.
there is
Enough.
yeah, there is not enough interpreters that meet those requirements,
Right.
and now the whole state is faced with a shortage of
Yeah.
interpreters. So yes, a driver needs to have a driver's license, but we got to be very careful on what we're
Yes.
asking for because we don't want it to backfire at us.
Especially with the amount of languages that we have in this country and the lack of training that interpreters have.
Yeah.
Yes.
And you can't be a certified interpreter in all languages out there.
No.
There are a limited number of languages that you can get a true certification for. You can be a qualified interpreter, you can receive training, pass an interpreter's skills test, but I think it's a gray area.
Yes. Well, this is why this question is interesting. Now, what would you change
So
related to policies?
I'm like on the whole other side of the spectrum, like not even talking about qualifications or certification. If I could change one thing, being someone in the hospital providing these services, I would change reimbursement for interpreter services. If insurance providers consistently reimbursed for language services, most hospitals wouldn't see it as a cost burden,
Mm,
and they would try their best to provide better quality services.
mm,
And patients would have better access to qualified interpreter. And that would really ensure a safer and more equitable care. A lot of hospitals and healthcare systems look at having these services as a bare minimum.
mm,
Okay, we have the service. They don't really care about the vendor they're using, the quality of services the vendor is providing. They want to go with the cheapest vendor out there, which I disagree with, because when you spend money, when you invest in the resources you're providing, you have better outcomes in the long run. So if we could get reimbursed only for a partial, or I don't know, something that would help the operation of these services at a hospital level.
yes.
Yeah.
Carlos, did you complete your statement earlier, or did you want to add anything else?
Did complete it, but I got caught up, and I was, the challenge that mandating that, like, the interpreters and translators to be licensed, that is a challenge I would love to have. And I think that if you're really a qualified translator and interpreter, there is no reason why you shouldn't be certified, at the very least, or even licensed, right? I think that if there's a mandate, and then a grace period is given of 2 years or 3 years or five, whatever the legislature takes into consideration, that is something that can be done. They can mandate licensing, but also provide a grace period. For every interpreter and translator that wants to operate in healthcare, they need to be licensed, and let's just give them 5 years to get this done. And that includes training, that includes a whole bunch of things. And of course, you have to take into consideration languages of limited or lesser diffusion. And so, but there will be like classifications, for, like, say, Mixteco, which is a language spoken in southern Mexico. There most likely is never going to be an oral exam to test
No.
competency for that language, but you do need to provide some kind of qualification uh, documentation to the licensing board. I've been doing this for 10 years. That could be one evidence. Or you're proven that you're bilingual because you speak in your community, and what kind of things that could prove that you're bilingual. Well, that is up to the legislature to mandate. But what I'm saying is that it can be done. It's just a challenge that I would love to have, and there could be a grace period on this, but I think that is the next step. It needs to happen, and once people are pushed into doing it, they'll do it. Right now, there's no mandate, there's no requirement, so they just don't do it.
But I also think it would limit the resources for us, like you were saying, Moojan. It is very interesting, and I think this subject will be so great to touch on a webinar that we would want to do for interpreters. Hearing this part, and also hearing maybe reading their comments about this will be great. So I will take note of that, and I will be contacting you, both of you, so that we can talk from an interpretation, from an interpreter point of
From
view on this.
operationalizing it at a system level, like at the frontline level, because we are the ones, like, if this
Mhm.
becomes a mandate, it would be my job to make sure all my
Right.
interpreters are
Yeah, yeah,
requiring and needing
exactly.
the license. How many of them am I going to lose? Yes, there are specific requirements that we have at our hospital that if you're an interpreter, you need to meet them, but they're more relaxed than what's really out there, like in the state of Oregon, for example. So it would
Right.
be a big challenge. Carlos, I know you're saying you welcome the challenge, but I'm thinking about it as an operation point of view. What's going to happen to what we're providing to our what we're currently providing to our patients?
That is
Let's think about this as the carrot, right? So there's this mandate, and now then we already have this sort of like a mandate that we can go to the federal government and say, okay, now we need to train thousands of people. We need a grant for this, and so there's that need for that grant money to come in, and so once you start offering money to interpreters and of course everybody will get certified and licensed. Right now, there's no incentive to be certified. If you go to a hospital and looking for a job in a hospital, what the job description will say, certification is preferred, but it's not.
But I
And
think
come on,
it really goes back to the organization. If the organization says, yes, I will give you a bonus if you pass this test, or if you are proficient in this language and we put you through a test, I think it really goes back to the organization, and mandating it at a federal level or at a state level just brings more burden on some organizations with less resources. But definitely, Kathleen, we can talk about this in a different
yes.
webinar. This is a
Yes, I
hot
would.
Yeah.
topic, and I'm
That is
very
this
passionate about it.
question. This specific question is a webinar title. This is
Yep.
a wonderful question. Stefan,
Yes,
do you
indeed.
want to add anything?
Yeah, probably yes. Yeah, I think yes, very super interesting topic. And touching on what both Carlos and Moojan have said, well, I think that they both have a point, and a very obvious one. And I'm also a bit torn about it, to be honest, because yes, it always helps when you have some kind of process that certifies and confirms that this person is up to the job that they claim they can do. But on the other
Definitely.
hand, what Moojan just said, and we all know that in the industry, right? So we don't have enough interpreters as it is, right?
Hmm.
Very far from that. And also, I think another factor that plays a huge role in this situation is that, and it's a very unfortunate one, of course, but the prestige of the profession is not where it should be, right? We all know that. So
Beautiful.
yeah, so when you want people to jump through all those hoops just to be able to start doing something, at least they should see the reward, right? They should know that at the end of this process, like if you're a doctor or nurse, you know that you will be making enough money to live comfortably,
Yes, it's not
right?
happening right now.
Yeah, yeah, so and if I'm an interpreter and I'm just, well, maybe it's my side job, maybe I'm really good at it, maybe I'm passionate
Mhm.
about it, but still
Yes,
it's not
a
something
career.
that I can't confidently bet on this as my main occupation in life,
Yes.
right? And when I'm asked to add this and that and this sort of thing, and then and most likely I will have to pay for most of those, right? So on top of everything else, so I will have to pay for this, for that, just to be able to be where I am now. And I think we just can start losing. So there are requirements, yes, but requirements should go hand in hand with funding, right? So the very same organizations. So I mean, it can be federally or state level invoked, but at the end of the day, people will perceive this as coming from the organizations that hire them
Mhm.
directly, right, from a
Yes.
hospital, right? So, and if you're a hospital and you're asking for all those additional documents, then at least you should be able to offer something extra to those people who have it, and not just kind of you know stay where you currently are. And this
Hmm.
and this goes
Yeah,
for
I agree.
the language service providers as well, like us, right? Obviously, so I don't see much appetite in this ecosystem for raising wages or raising
No.
the interpreter pay, unfortunately. So I think this is just another barrier on this way.
I could probably speak from all points of view. I could speak maybe from the client side, from the language service provider side, from project management and everything. And I could tell you that as an interpreter, it is very painful to see some interpreters being receiving an X amount of wage when I know the experience that they hold. I commented to one of my friends and I said, these people truly don't know what they have, because the way that I've seen you taking on interpretation work and the policies that you handle, and just all of this is, you are a top professional, and I would love to see us in the interpretation industry be paid as we deserve. um, I went through an experience not so long ago. I was in a hospital in an emergency room. This is just going into what I would change, right? And as an interpreter, everywhere you go, you're looking or you want to help somebody when you hear them struggling with language. So there is a lady registering her child who had a cut on her forehead, and she could not speak English. She's speaking in Spanish. And I say, I am a certified Spanish interpreter. I want to help. I could help. And the lady in the front desk said, no, you're not allowed to help. And I was like, I kept going back to kind of help. And they told me I couldn't. So they asked the other lady in the front desk to help out. And the interpretation that she was rendering was just horrific. And she left out so much important information that I was aching. My stomach was hurting. And so I know that some hospital policy is to not provide interpreting services starting at the front desk. And it is as important in the front desk as it will be to have a procedure done. This is the starting of a very important conversation where the patient is probably going to let this person know why they're being brought into the hospital, emergency room, wherever. So making sure that that our services are prioritized from the beginning of the encounter in a healthcare organization until the patient is discharged. Misty also added a comment here, very interesting. She says, we had providers that were speaking in their languages to patients and insisted on taking the interpreter's test. Guess what?
They failed.
The skill set was not there. I'm sure they handled the vocabulary, Misty, but they failed the test. I have great respect for interpreters who go through the process. Thank you so much. It is a tough and expensive process, but we understand how important it is. I would love to also see, going back to the interpretation side, to also see the certifications and qualifications being open to interpreters that are not US based, because there is so much talent out there and they're doing so much for the organizations in the US right now, especially for languages of lesser diffusion. There was a question on the chat coming from Alex. He says, how do you inform LEP patients that language services are available? Translations. Let's post stuff.
Signage.
Yes, signage.
It's actually in California, it's the law. You have to post it. So we have the English version, it's the law. You have the right to an interpreter posted in English. And in our top two languages that are over the 5% threshold, which is Spanish and Farsi. So we have that translated, and we have little table tent signs that when I round or when my people round, we hand it out to LEP patients that says you have the right to an interpreter. We have these services available to you 24/7 at no cost to you.
Yes.
Please ask for an interpreter. So you just have to make sure that you're communicating that with your LEP patients and family members.
Absolutely.
Yeah, I think communicating that over and over again is the way to go. I mean, patients should know that they have access to language services, because why? In the back of your explanation of benefits, it says it in different languages as well. It's just that a lot of people just don't read it. And so I think there needs to be a campaign specifically designed for that.
Targeted to that. Mauricia, go ahead.
Sorry, a lot of people, me working in a nonprofit Catholic hospital, we have a lot of uninsured patients that come through our doors. So they don't have an explanation of benefit. And they're the ones that need these services the most, actually. So how are we communicating to them who are uninsured and they're just here because it's an emergency and they had to go to the hospital?
Videos for those people who need to be signed, sign language, or I don't know, printing in different languages. That's important. We were asked for Braille the other day for some signage, and I thought it was great because in language access, and I've seen it over and over in maybe roundtables, we always talk about the spoken languages and forget about at times the non-spoken languages that also need this information. But I do know that these minorities, they do a great job communicating to their folks the rights that they have. At least that part I know.
In the
Yeah,
community, yeah.
Yes, to
yeah, I
their
think
communities.
I think there needs to be a targeted marketing campaign, and yeah, and just let me just give you an example. And before I was talking about the Mixteco population in the Monterey County here in California, there are different variations of Mixteco. So what this one organization ended up doing is recording a message in Mixteco in several variants of Mixteco and distributing it through WhatsApp, and that's how they were able to reach the community.
Wow,
So
that's
I
wonderful.
think every
We lost Carlos again.
hmm
All right, let's go into, I think Luis posted a comment. He says, according to federal law, primarily through Title VI of the Civil Rights Act of 1964, this is why we exist as interpreters, and this is why our positions are so important in the language access industry. Any organization receiving federal funding must provide interpreter services to individuals. This is correct. This is correct. And this is what we should all communicate.
Right.
And I think that going back to the disbursement or reimbursement of those services, uh, the law is the law, and if you have to provide language access services, you're mandated by law to do it. I mean, it's the cost of doing business as a healthcare provider. If you cannot provide health language service, then there's something wrong in your math for your business. Maybe you shouldn't be in business because it's the cost of doing business.
It is. It is. I think I did not read Luis's comment completely, and it's important that I do. Okay, so I said must provide federal funding, must provide interpreting services to individuals with limited English proficiency, ensuring meaningful access to services regardless of language barriers. This includes healthcare providers, government agencies, and educational institutions receiving federal funds. It is true and correct. All right, so let's move on to our last question. We just have a few more minutes left, and I want to make sure that we're able to touch on this one. If you had unlimited resources, what would your dream language access program look like?
Let me get my laundry list. No, go ahead.
I can start on that. With unlimited resources, my dream language access program would combine the best of human and AI technology. Because AI tools can provide instant language support for basic communication, when highly trained human interpreters would handle more complex medical discussions like goals of care or end of life conversations that you really need that human touch in the conversation. If we do this, then it would be accessible 24/7. I know a lot of vendors or providers, language plan providers say that, oh, we have these services 24/7. But in reality, sometimes there are glitches. So if we do this, it would be truly 24/7. It would cover all languages, even the languages of lesser diffusion, and it would integrate seamlessly into every point of patient care. Kathleen, you mentioned at the registration when the patient walks in, really having an interpreter and understanding everything is through the whole progression of care. When the patient comes in through the ED or through the emergency department, all the way through surgery and getting consent for a procedure or surgery, and ensuring that patients and every staff, not just patients, our staff is also understanding what's happening in the conversation.
Agree. Stefan, I think you have good stuff here.
Well, yeah, I think as with some other questions, it also depends on who we think must have those resources. So what's our focus, right? What is the angle that we're looking at the situation from? So for example, a language service provider, so unlimited resources for us probably means to have enough interpreters for any occasion, right? And in any language. So for a healthcare organization, it might be like having enough budget to
Yes.
procure these services whenever they need it. So it's kind of different, and I think we can all agree that regardless of the budget and everything else, there's always a shortage of interpreters, right? And we can't have enough. So yeah, probably my dream would be to, as Moojan said, I'm not sure it should be again. So AI is very helpful because it solves all those problems very cheap and automatically, right? And so it's not, you don't even have to have any kind of unlimited resources to leverage that, right? If it's there, so it's unlikely that it's going to be just your AI that only you have, right? So it's going to be something more generic probably, and in which case it's going to be probably very cheap and wouldn't require you to have any kind of extra budget or something. So, but yes, I think generally speaking, it's to have an interpreter for all patients who ever need it at all times, and a good one, a good interpreter too, right? So not just some interpreter, but a good interpreter who will be really helpful and will do their job well. Yeah, I think this is the dream.
Yes.
Yeah. Real quick, I see someone saying no AI. I disagree. Let me make
always do
myself
that.
very clear. I am not saying that AI should do everything. I completely disagree with that. But AI technology can really automate a lot of things that we're manually doing. And if you listened to what I said, I did mention it needs to go hand in hand with human interpreters, qualified human interpreters. It would just ease our way as healthcare providers at the front line to use more simple communication versus communications that really require that human touch.
Complex.
Yeah. And also AI is an all-encompassing term, right? So different people, mean very different things saying this. So I think it's fair to say that many people would maybe some years ago would tell no computer, right? No computer, because they would think of a computer as something that ruins this particular field or something. But it turned out after that computers can be used in a variety of ways and very beneficial ones too. So same with AI, it's not just to replace something valuable that exists, right? It's just another means to an end. And so in that way, I think that it's unavoidable that it will be used more and more going forward.
I agree. No replacing, just working with technology. And I think we've all, in all webinars and roundtables that we have, that I have participated on, this subject always comes up. No AI, especially from us interpreters. But I think we just need to work together to enhance what the technology has brought. And who knows, maybe it makes our job easier. Who knows?
There's that saying I've heard in several conferences that says, "Oh, there's this fear that computers and technology are going to replace interpreters and translators." And so what I've been saying is that no, interpreters and translators that do not know how to work with technology are going to replace those.
Exactly.
Right.
And using AI it's a very open terminology. Like, what do we even mean by AI? Exactly, as Stefan, you mentioned that, but it's really how to use it to your benefit. What Carlos exactly said,
And just as a translator, this is just an example that I'm going to give you as a translator. I was looking for a translation for cobweb, which is a really old spider web, right? But when you go into Spanish, spider web is telaraña and cobweb is so telaraña, but it's different, right? So it took me with AI, working with AI, about 10 minutes to come up with a new word.
Right.
That will describe what I'm looking for. And in the past, without AI, that would not have been possible.
Absolutely. And also, if anything, I think that other professions like coders and software engineers are much more peril right now than interpreters. Yeah, even though those professions seem to be so safe and kind of sexy, right, in today's world. But actually, what AI can do with code is much more impressive than what it can do with live communication. So, yeah, I think
just how impressive it is. I was able to find that word for cobweb, which is telaraña. It was a word used in the 1500s, and AI found it for me. And that's what it was. It was an old spider web.
Right.
Wow.
But so it's kind of a something in your tool set, right, that you can use, and probably the software of the future will incorporate this, so you will be able to using as an interpreter, just have this companion able
Mhm.
to send you hints, right, and
Yeah.
maybe help you
In
out in some
addition to,
difficult situations when you're at a loss or you're looking for a word or something. Then yes, absolutely, but it's kind of more helping you out than trying to replace you. Yeah.
I agree. Mauricio on the chat says it is like using technology, just a type of technology. It's just a type of technology, but we need to learn how to use it properly with a lot of finesse.
Mhm.
I like that.
Yeah.
I like
Nailed
that.
it.
Good
Nailed
I
point.
it.
like that.
Yeah.
What if I had limited resources as a language service provider? I will make sure that we can enhance 24/7 on-demand interpretation. I would like to hear the client's feedback, how, and I think we're kind of doing that right now, how they would want us to enhance it so that they could use it more. I'm not sure why. Still to this day, some clients are not wanting to use on-demand services, and I think it's a great tool. Um, make sure that our staff are also fully trained interpreters that are fully trained and understand how to leverage every situation or most situation in our industry. How can Stefan will probably help me in the future when we have unlimited resources? How can we enhance our services or the interpreters operations and services with AI? I would love to see how this will look in the future for us. And I think this is all for our conversation. Very interesting. Thank you so much to those of you who added a comment on our live session. Thank you so much, Carlos, Stefan, and Moojan, for your participation and your input. Very interesting, nailing all the answers. Thank everyone for your time on LinkedIn. If there are any questions or any other consideration that you want to drop on the chat, please go ahead and do so. It will remain on LinkedIn and we will go ahead and get back to you. So that is all for us. Thank you once
Thank you,
again.
everybody.
Thank you,
Have a
everyone.
great rest of
Have
your
a good
day.
one.
It was a
Thank you,
pleasure.
everybody. Thank you for inviting me. Thank you.
Absolutely. Thank you for joining us.
Have a great day.
Thank
Bye
you.
bye.